It's not really about your ovaries. It's really about insulin resistance. And I am talking about the 1 in 10 women who have polycystic ovarian syndrome, also known as PCOS. Just in case you are wondering about what the symptoms of PCOS are, some of them include irregular menstrual cycle, excess weight gain, especially around the middle, excess hair growth, hair loss on the head, acne, as well as difficulty getting pregnant. The root cause in 70% of cases is insulin resistance. If you are wondering what insulin resistance is, it is a situation or a condition in which your body produces high insulin levels because your cells are not responding to it. With high insulin levels, this tells your ovaries to produce high testosterone levels. And so the high testosterone level, which is the male hormone, causes the symptoms of excess hair growth, acne, difficulty getting pregnant, and all the other symptoms I mentioned earlier. Now, here is the test that most doctors will skip. The 2-hour glucose tolerance test with insulin levels. Not just the glucose test alone, with insulin levels, because we also have to know your fasting insulin level, 1-hour insulin level, and the 2-hour insulin level. Because the standard fasting insulin or glucose level often looks normal in people who have PCOS. The problem is usually seen with the post-meal insulin and glucose levels. Some other tests that you can request for if you think that you have PCOS, your primary care provider should be able to order this test without you requesting. But these tests include your A1C level. You will also need to know what your lipid profile is, your lipid panel. You also request for a free and total testosterone level, which is the male hormone. And lastly, the DHEA-S tests. All these tests will just help your primary care provider understand how to best manage your PCOS. In essence, treatment of PCOS is not just taking birth controls to regulate your menstrual cycle. No, the insulin resistance needs to be addressed. In most cases, Metformin is given just to help with the insulin sensitivity. It works, but you know what works better? Lifestyle changes, low glycemic diet, more protein, exercise, especially strength training, and stress management. There has been some evidence that inositol supplements, especially the Myo-inositol, has been able to help improve insulin sensitivity in people with PCOS. Speak to your healthcare provider if you are considering it. If your doctor dismissed your concern or only gave you birth control without investigating your insulin levels, I guess it's time for you to find another doctor who understands PCOS. You deserve better treatment.